Greetings, everyone, and I'd like to thank you for coming in and joining us for this World AIDS Day program. World AIDS Day takes place on the first day in the month of December each year. It is an opportunity for people worldwide to unite to fight against HIV, to show support for people living with HIV, and to commemorate those who we have lost through AIDS-related illnesses. Founded in 1988, World AIDS Day was the first ever global health day. In 2019, over 1,189,700 people ages 13 and older have been infected by HIV in the United States.
Over 35 years ago, the first documented cases of AIDS brought about an era of uncertainty, fear, and discrimination. HIV and AIDS has taken tens of millions of lives, and far too many people with HIV have struggled to get the care, treatment, and compassion they deserve. But in the decades since those first cases, with ingenuity, leadership, research, and historic investments in evidence, case-based practices, we have begun to move toward an era of resilience and hope, and we are closer than ever to reaching an AIDS-free generation. On World AIDS Day, we join with the international community to remember those we have lost too soon, reflect on the tremendous progress we have made in battling this disease, and carry forward our fight against HIV and AIDS.
My name is Jeffrey Allen Withers, and I'm a proud member of Phi Beta Sigma Fraternity Incorporated, Delta Sigma chapter. I joined Phi Beta Sigma in the spring of 1998 at Barber Scotia College. Currently, I'm the Director of Social Action for the Delta Sigma chapter in the great city of Winston-Salem, North Carolina.
Good evening. My name is Nisha Daniels, and I am a proud member of Zeta Phi Beta Sorority Incorporated. I became a member in spring of 1993 at Winston-Salem State University. I am currently the president of my chapter, Utah Zeta, of Zeta Phi Beta Sorority Incorporated. Good evening.
Today is the 33rd annual World AIDS Day. HIV and AIDS has been a pandemic the world has yet to get under control. HIV and AIDS was once known as a gay problem. Then it was a Black problem. To correct those miseducated stereotypes, HIV and AIDS is a problem for everyone who has sex with another person. HIV and AIDS is a problem for anyone who shares bodily fluids.
Today, the ladies of Zeta Phi Beta Sorority Incorporated and the brothers of Phi Beta Sigma Fraternity Incorporated would like to present Ms. Ayanna Sutherland. Ms. Sutherland is the public health educator on STI and HIV for Forsyth County Department of Public Health. Ladies and gentlemen, welcoming Ms. Ayanna Sutherland.
Good afternoon, everyone. I am Ayanna Sutherland, and as she stated, I am the HIV STI public health educator here at Forsyth County Health Department.
Hi guys, my name is Amani Pinkney. I also work here at the Forsyth County Health Department. I also work in health education with my coworker Ayanna.
Yes. Well, we are a program initiative here at the Health Department, POSSE. POSSE stands for Prevent Ongoing Spread of STIs Everywhere. We are both certified by the state of North Carolina to conduct pre and post-test HIV counseling, and we are also phlebotomy trained as well.
And a little bit of what we do, we are very big on outreach and community work. We do go out into the community, to the local universities, and we test for STDs, STIs, HIV, syphilis, and hepatitis C. We do offer free services because that is kind of, hard to find if you don't have the correct access. We do offer free services here at the health department. We have a mobile walk-up clinic on Mondays and Fridays. We also offer our free services at local United Care Health Centers. And if you are in the Forsyth County area, feel free to Google and find the nearest one to you.
Yes. As he stated before, but we just want to reiterate it. So today is World AIDS Day event, which is acknowledged on December the 1st. And basically it is to bring greater awareness to HIV as well as to commemorate those that are affected by the disease. An interesting fact is today is World AIDS Day and is regarded as the longest running disease awareness initiative of its kind in public health. And also statistics, because that's what we base our testing on and what we gear our testing towards. So altogether, there is about 38 million people worldwide who has HIV. And then to break it down even further, in the state of North Carolina, it was reported in 2018. So they conduct census over a year. So the census that is still running is from 2018. So in the state of North Carolina, it was reported that 31,864 individuals were living with HIV. Also within that same year, 1,187 new cases were diagnosed. To break that down even further on the epidemiology level, that is 364 per 100,000 people in the state of North Carolina. So 72% of those are males. 28% were identified as females living with HIV. 61.3% are African Americans, 8.5% are Hispanics, and the rest, 24.7%, are white. And that's in the state of North Carolina. And then age range, we even break it down by age range and look at age range in our job. And then the highest age range with HIV living in North Carolina is age ranges 35 through 44 and 55 and older. And those two age categories have the highest percentage living with HIV in North Carolina.
So when we talk about AIDS, you have to start with HIV, which is the human immunodeficiency virus. And AIDS would be the last step that comes with when you are not properly taking care of yourself. You don't know your diagnosis. You don't know that you're living with HIV, or you do know and you're just not, properly taking your medications. So we always highly recommend to get tested. That's the only way to know for sure that you have HIV. And also with HIV, you can have the antibodies in your body at the time of testing, and it just has not shown up yet. So you could test on a Monday and test negative, and you do have the virus. So we do recommend that if you are concerned about anything, any past or previous behaviors, and you get tested and you come back negative, please get retested, because the antibodies could be in your body. It just may take a little while for them to show up. And HIV that leads to AIDS, if not properly taken care of, can lead to, just a compromised immune system, and it could lead to eventual death.
Yeah. We also educate individuals. HIV can be spread through breast milk, vaginal fluids, rectal, breast milk. It's breast milk, vaginal, rectal, and blood, and semen. It can be passed through those 5 channels of transmission. We also learned that with the Medicaid, if you are diagnosed with HIV, it's not a death sentence. It used to be recognized as a death sentence, but it's a medication you take. It's tailored to your personal needs. So we refer anyone that comes through the health department and they get flagged as positive, we refer them to Atrium. Now, it was Wake Forest Baptist, now it's Atrium Health. And they administer medicine tailored to your specific needs. And also another interesting statistic that we learned recently was in 2020, there was 0 transfer of HIV from mother to baby. So that was an interesting fact that we learned today, actually.
And also, as she said, if you do get diagnosed with HIV, it is no longer a death sentence. There are progressive drugs that have more than expanded a person's lifetime and able to live a full, healthy life. The main important thing is to be consistent and be intent about taking your medication, staying on your medication to not only protect yourself from worsening and it leading to AIDS, but also protect the person you love and the ones you love. So we do recommend just knowing that it's not a death sentence. You can live a happy, healthy life, but you have to be intent on keeping up with your medicine, keeping up with your primary care provider, and using those barrier methods to prevent the transmission of the disease.
Yeah. Some barrier methods. Of course, use condoms. Is it on this one? I want to get the correct terminology for you guys. Oh, use latex condoms. And when you are using latex condoms, we advise individuals when we're doing the counseling, don't use oil-based lubricants. That includes hand creams, massage oils, Vaseline, because it can break the condoms. And then we also understand that some individuals are allergic to latex condoms. So they have, here at the health department, we offer a variety from goat skin to polyurethane condoms. It's a type of plastic to tailor everyone's needs. And we also have female condoms here to use for safe sex practices for like oral sex. Other things that we do here, if you are diagnosed with HIV, to just say not have sex is not the answer. We also, if you want to participate in having sex and you have HIV, we tell you to be honest with your partner that you have HIV. And we also strongly advise that you are currently active taking the medication if you are going to participate in those sexual activities. But if your viral load is high and you still want to participate in sexual activities, we also advise by saying participate in alternative methods like masturbation or sex toys. So those are some ways we try to be all-inclusive to everyone that we encounter.
And also along with that, upon further identification that you do have HIV, we do recommend that you talk, as she said, talk to your partner and talk to your partner about using PrEP. A lot of people we encounter when we are out in the community doing testing and outreach have no idea what PrEP is. And PrEP is very essential when it comes to, HIV and all of that. PrEP stands for pre-exposure prophylaxis, and it means your partner, if you are diagnosed with HIV, your partner or whoever you are sexually engaged with should be taking PrEP, so that lowers their chances of getting that disease, of course, along with you taking your medicine. So when you do take your medicine consistently, it will drop your viral load count to well below undetectable, which lessens your ability to transmit it. And if your partner takes PrEP, that lessens their chances of getting the disease as well. So it is a thing where you have to be aware and your partner has to be aware. You don't have to be alone. It is a big responsibility, and we do recommend that you talk to your partner and you guys both get on the same page about the steps and the precautions you want to take when dealing with HIV.
Yeah. PrEP does not protect you from any other STI. So when you are taking PrEP, it is strictly for HIV people. And most of the individuals that are taking PrEP is a part of the MSM community. MSM, it stands for men who have sex with men. And that is our main concern right now in Forsyth County, North Carolina, and just throughout the country. Is AIDS and HIV then developing into full-blown AIDS is on the rise with men who have sex with men. At one point, statistics were showing, data and statistics were showing that HIV was being leveled out. But here recently, even with the pandemic coming up, even with the pandemic occurring, everyone's staying at home. The MSM community is on the rise. The numbers are extremely high, like in the 70–80% percentile range of contracting HIV. So we also, how HIV, even though we explain how the modes of transmission of HIV happens, HIV can also come from sharing needles, injecting drugs, and coming in contact with other blood mucous membranes. And so we also encourage individuals that we do testing at comprehensive drug treatment centers as well, ARCA Winston-Salem Comprehensive Center. And we don't promote drug usage, but if you are going to participate in those types of activities, we also recommend the needle exchange program. And we also do testing at a needle exchange program here in Forsyth County in Winston-Salem off Miller Street. And you bring your dirty needles to this location. It's a needle exchange program. So that is one of the main, another high way to get HIV is through using dirty needles. So we encourage the needle exchange program. We don't necessarily, we're not encouraging drug usage, but you just use a clean needle if you are going to participate in those types of activities. And then North Carolina has a plan to stop and minimize STIs, not STIs, HIV. Of course. Okay. They have a plan. They have the Raleigh has created a plan to help stop HIV in North Carolina, and they also have campaigns like Let's Stop HIV Together and My Voice, My Action. Those are different campaigns that you all can research, and it's concerning and dealing with HIV, how you can donate money, raise awareness, and learn the different symptoms and ways that we can help stop this epidemic in North Carolina. So we have North Carolina has a very extensive plan on how they can stop this disease. And I like the plan. So the plan is broken down into different pillars. So the pillars is policy and promotion.
So yes, North Carolina in their plan to reduce the spread of HIV and AIDS in general, the biggest thing is policy and promotion. So I believe somebody said this before, I'm not sure, but a lot of times, especially in our field of work, we'll see HIV in underserved populations or underprivileged populations. So the thing about policy is you want to spread the information, you want to give underprivileged people the opportunity and the access to get tested, which is why our program offers free testing, because a lot of people don't even have access to know their status. And it makes no sense for us to preach, get tested, know your status, and you don't have health insurance. You can't afford health insurance. The nearest health clinic or hospital is on the other side of town, and you might not have a car, you might take the bus. So the biggest thing is making sure North Carolina and the health clinics, health providers find some type of way to reach out to these underserved populations and get them aware of HIV and the spread of it and knowing their status. And just education is everything. The biggest thing is letting people know this is what this is and this is how you prevent it. If you can work from a prevention standpoint, that lessens the disease in general, but we have to attack it from a prevention standpoint. So policies, just and speaking in multiple languages, speaking to people who may not have a college degree, people who may not have even graduated high school. How do you get the message out to them? How do you help them understand what you're talking about? It has to reach across all populations, not just for the educated ones or not just for people who you know, are on top of their health and go to get physicals all the time. So that's a big thing for us as well. You want to focus on those populations that are at high risk. Also destigmatizing HIV/AIDS when it comes to testing and sexual intercourse and knowing your status. People tend to shy away from it. Oh, I'm good. I don't have to worry about it. I'm fine. I know my partner. I've been with my partner for years, or whatever the case may be. Or when it just comes to, we've been at a health fair and tried to give out condoms, and people just, you know, get a little scared, get a little timid, get a little worried. So the biggest thing for us is like, how do we take away that fear from talking about having safe sex? How do we talk about that fear from talking about HIV can be scary, AIDS can be scary, but this is how to prevent it. So that's a big thing as well. We want to destigmatize talking about it. We want everybody to have the correct tools to prevent themselves from getting HIV.
Yeah, we have other people on our team, but we're the main two here. We always joke. It's not a joke, but we always tell the community, when you see us coming, you don't want to see us. You don't ever want to come see us at the health department. Maybe you want to see other people, but when you see us come with our uniforms on or our jackets or wherever you see our name tags, you do not want to see us. So that's just a joke it's not a joke. That's just something that we tell people. Like she said, it's very important to get tested multiple times, not just one time or say I'm good or I know my partner. It is very important to get tested over and over and over again, because you never know. And as we stated earlier, sometimes the viral load is not detected if you were to get tested earlier and you are still concerned or you're still not feeling well. It's important to get tested, because the last thing I want to do in my job that I do is to come tell you that you have HIV and you've had it for years. That is something that I don't want to do, but I've had to do here recently, and it is not. I think that's the hardest part of my job, having to tell someone that they have HIV and they have trusted partners. It's just crazy. And it's a world room of emotions that you have to sit through, and you can't do anything about it necessarily, but provide hope. But yeah, that's just one of the hardest parts of my job, sitting in a room telling someone that they have HIV.
And so the next part of North Carolina's plan to reduce the spread of HIV in the population living with AIDS, well, not reduce population, but reduce the transmission of AIDS, we want to get the message out about testing and being treated. So like I said, destigmatizing it, bringing up those conversations in barbershops, beauty salons, and nail shops. Maybe not so much the whole conversation, but just getting out the conversation of getting tested and knowing your status and things like that. And also being able to talk to those people who may live a high risk lifestyle, people who do inject drugs, people who may be a sex worker or anything like that, do drugs or anything like that. So you do want to have some type of compassion and humility and cultural sensitivity when it comes to working with that population, talk to that population in general. The last thing we talk about is engaging and embracing, as I said, and you just identify those populations who are living with HIV and figuring out how to get them access to PrEP, which I mentioned earlier, which reduces the chance of you spreading HIV to your partner. So we want to educate people, get them tested, know their status. If you do have it, which our job comes in, you have HIV, this is how you prevent it from prolonging and turning into AIDS. This is how you prevent it from spreading to your partner. These are the steps. Let's get you set up with a primary care physician. They'll set you up with a treatment plan, and so on and so forth. That's the biggest thing for us. And it does start with the community. We do a lot of college testing. And I feel like that's a big thing for us. I feel like it's very important, especially at that age. And so I feel for us getting out and doing the colleges, doing the drug rehabs, doing the free mobile clinic, it helps get the word out. It helps reach those people who otherwise may not be interested, otherwise may not hear about our message about HIV, AIDS, etc. So that's the biggest thing, to reduce the disease and reduce the spread of it.
Yeah. And something that I had to write this out because I wanted to say it word from word, but something that stood out most to me when putting this whole event together is, yes, we can educate. Yes, we can continue to go out to do testing and be the resource, which we are the resource for the community. But the most important thing on how that's going to stop the spread, or not even stop the spread, but that's going to tackle this epidemic, is we must address the social determinants of health that contribute to the unequal health outcomes and improve access to status neutral HIV treatment. And like she said, that's breaking down barriers, re-looking at policies that were put into place before, because as he stated earlier, it was just a gay man's disease, or, you know, only gay men could get it. But that's not the case, as more knowledge and information have came out. Basically, this is a feat to like putting your feet on the street. We have to go out there and physically overcome these barriers. We have to physically look at the policies that have been put into place that have stigmatized these individuals, and not necessarily rewrite the policies, but we have to find different ways that we could provide access. Also, we as public health professionals and educators, we need to ensure high quality, culturally affirming healthcare at every management, and making sure we are supporting optimal health for people with and without HIV. So we, as our job, we support people with and without HIV, as along with other things, syphilis, gonorrhea, chlamydia, trick. We do all of that here at the health department. So that's very important to us, and we are always attending different meetings, webinars. I mean, you name it, we're in it. We're getting so on how to just better serve our community so we can better serve you guys. Have the most up-to-date information. So when we are out in the community, we are very well versed and informed on how to help the population concerning, like I said, not only HIV, but everything. And that's what we have for you guys.
Okay, ladies, we have a couple questions that were brought up during this presentation. I want to go ahead and air those.
Okay.
In 2021, is it still possible for a woman to spread HIV or AIDS to a child, or can a person with HIV or AIDS have a healthy child that does not have the disease?
So it was two different questions?
Yes.
Okay, what was the first question? I'm sorry.
Can a person with HIV have a healthy child regularly?
Oh, yes, a person with HIV can have a healthy child. That's why you take the medication that they provide for you. So it's important, if you are HIV positive, it's important for your sex partner to be on PrEP, taking the PrEP medication, but it's very, very important for you to take the medication that is assigned to you by your doctor, so your viral loads can remain low. And that if your viral loads are low, that is how you don't transmit or spread HIV to your unborn child if you are pregnant. But yes, you can have a healthy baby that does not have HIV in 2021.
Okay, one more question. if I'm a 16-year-old kid and I'm trying to practice safer sexual activities, where do I go to get the tools that I need to stay safe?
At 16?
Yes.
So I know a lot of health departments. I don't know if you're in Forsyth County, but here at the Forsyth County Health Department, we do give out free condoms. And I'm pretty sure a lot of health departments do as well. So hopefully, you can find the courage to go to the health department and just say you want free condoms. We give them out all the time. Don't be shy, don't be nervous. We have no problem giving out free condoms. There's no question asked. We don't tell your parents, we don't ask for that information. So it is a safe place.
Yeah. And we test here at the health department age 13 and up. And when you do get tested, it's by our discretion. We cannot release that information to your parent, even though you're still considered a minor, unless you sign a release form that we can release that information to your parents. But when your results come in, the number and the contact information that you provide us that's how we're going to relay the results. So, and then we do a lot of community work. So I consider us friendly people. So just walk up to us, have a conversation. Our number is, we also possehealth.org, and individuals can go on possehealth.org and scroll all the way down to the bottom, and our picture, our job title with our contact information is all on possehealth.org if individuals want to reach out.
Okay. Ladies, I would like to thank you all for showing up and giving us this excellent presentation today. This is a great way to start the way to ending HIV and AIDS in 2000 and going into 2022. I would like to thank the lovely ladies of Zeta Phi Beta Sorority Incorporated and Utah Zeta Chapter and the lovely Miss Nisha Daniels for joining us today. My name is Jeffrey Withers, and before we conclude this program, today is December
Mr. Withers?
1st. Yes.
Hi, my name is Jennifer. I am a friend of Ayanna Sutherland.
Mhm.
I wanted to thank you. Sorry to interrupt you. I'm teaching class for having this program, but I am a nurse at the health department at High Point, and I think this is very important. Thank you all for having this. I do want to let you know that in the last 30 days, we have diagnosed 3 Black males under the age of 30 with HIV. I'm sorry, with AIDS. It's a big thing here in Guilford County, Forsyth County as well. And syphilis is on the rise as well. So I thank the 2 ladies who've given the information. I also wanted to thank you guys for having this program. It's very, very much needed. Sorry for the interruption.
Oh, no, thank you.
Thank you.
Thank you.
All right. Now, are there any other questions? All right. Well, with that being said, today is December the 1st. I would like to give a very special shout out to Mr. Carlos Brown, whose today is his birthday. So happy birthday, Carlos. I know you're watching today. I would like to thank our Bigger and Better Business Spotlight, Miss GWG and Under Suspenders. And I would like to thank each and every one of you for joining us this evening. Thank you, and you have a blessed day. Good night.
There comes a time when we heed a certain call, when the world must come together as one. There are people dying. Oh, when it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere will soon make a change. We all a part of God's great big family. And the truth, you know, love is all we need. We are the world. We are the children. We are the ones who make a brighter day. So let's start giving.
There's a choice we're making. We're saving our own lives. It's true, we make a better day. Just you and me. Well, send them your heart so they know that someone cares, and their lives will be
Stronger and free, as God has shown us by turning stone to bread. And so we all must lend a helping hand.